Okay, so let's talk about staining and why it matters when recommending a rinse to patients. So rinses like chlorhexidine and Periomed are two common rinses that dental professionals will recommend to patients for a variety of reasons. But these rinses both offer some benefits to the patient, but they can also cause staining. So if it's used over a long period of time, staining will result. So in a sense, these rinses, they might help solve one problem that your patient is dealing with, but it also creates another problem. So let's face it, most patients care about their appearance. That's why you'll have a conversation with a patient about the root canal that they need to get done as soon as possible. And they'll proceed to ask you if they can get their teeth whitened. So if a patient knows one of the side effects of a rinse is potentially causing stain, they're less likely to use it. So therefore, this is going to decrease the likelihood of patient compliance. It ultimately becomes more work for us. So why would we want to create more problems for us to deal with? We already have, very limited time with the patient in the hour that we do get to spend with them. So why would we want to spend that time removing added stain? Removing stain is time consuming. If you know, you know. If you're going to remove it with a coarser prophy paste, this could potentially negatively impact the enamel. So that's not good for the patient either. Lastly, it's not very cost effective for your patient to purchase this large bottle of a rinse that you're recommending for them to take home, and then they can only use it for a couple weeks, and essentially it's just going to sit in their cabinet collecting dust after that, because they can't use it, otherwise they're going to get staining. Additionally, if they do end up getting stains from the rinse and then they want to get their teeth whitened, that's also not very cost efficient for the patient. Whitening treatments can be very expensive. So what other options are out there then? If you want something that's as equally as effective at killing pathogens, has xylitol added in to combat dry mouth, and is safe to use every day long term without the added negative side effect of causing stain, I'd strongly encourage you to recommend OraCare to patients. Patients are more compliant and willing to use the rinse knowing that they will not get stains from it. And if you're wanting to learn more about OraCare, feel free to head to our website and schedule a free webinar.